This video contains descriptions and footage of pathology procedures. The filming in this resource has been developed for educational purposes only.
My name's Harriet. I'm an Associate Practitioner for Biochemistry. My job involves assisting the biomedical scientists when they're trying to analyse bloods and produce results for the doctors to decide treatment. In this video today, we will be looking at how science and tech is used as part of my role. I usually work in 2 pathology laboratories within Aneurin Bevan University Health Board area. The labs in the video are the Royal Gwent Hospital in Newport and the Grange University Hospital in Cwmbran. These are just 2 of the hospitals in South Wales.
Within the pathology department, there are lots of different sections. Haematology does a lot of things to do with counting blood cells. Microbiology is at the Gwent, which looks at the microscopic living organisms like bacteria. At the Gwent, there's also cellular pathology, which looks at the diseases in organs and tissues. So these all work together to give a result for the doctor. We receive bloods in the reception. They register all the bloods onto our system for us so we can see what tests they need. They will then spin those bloods and hand them to us or haematology or whichever department. We then put those samples on the analyzer. They get analysed and produce a result. Those results go onto a different system for us to check, and then those results are available then to those doctors. What we do then with the samples is we will check them, make sure they've had all their tests done, and then we send them up to the Grange usually for any further tests if they have those special preparation tests. Some samples go to different departments. Some samples need to be made into a thing called a film so that haematology can have a look at the cells in the blood on a little piece of plastic under a microscope. When I was in school, I was really interested in the human body. I really liked anatomy and how things interacted with each other, and as I got more and more into the lab type of environment, I realised I liked the nitty-gritty, the small bits that made a difference. When I started in the lab, it was actually one of my first jobs. My family lived 2 minutes away from the Gwent Hospital and most of them worked in the hospital. My mum was a nurse, my dad used to work in the theatre, but I never really wanted to be patient-facing. I preferred the science and the puzzles behind the medicine. Another department in pathology is cellular pathology. They study diseases in organs, tissues and cells, and they use these tests to detect and diagnose cancer. In cellular pathology, some of the things that I've seen can be a little bit gross to some people. Stomachs being open on trays. We deal with a lot of faeces and urine as well. That's poo and wee to you and me. The tests that we do on the poos are all actually thanks to my mum, because she works as a specialist endoscopist in the Gwent and she helped pioneer these tests with the help of some clinical scientists from work to do with bowel cancer, which makes me very proud, very grateful to my mum. Usually my day starts with setting up the analyzer and then doing the quality checks, so we make sure that the analyzer is performing as it should be. And then we top up anything we need to, any of the disposable type things, and run samples then all day. At the Gwent, we don't do any GP work, so normal doctor work. We do all inpatient work, which is people who are actually in the hospital. The Grange then has all the GP work, all the doctor work, and then all the really emergency type work, because they're the only A&E in this health board. So these are all done, they've come off the analyzer now. We've got to check that they haven't got any special tests and put caps on them. So then we check the sample on our system to see if it has any extra tests, which this one does. So we put it in this rack to go down to the Grange Hospital. the Grange Hospital. We've got a big track system, so it's like a big conveyor belt which takes all the samples to the analyzers. Sometimes we need to do specific prep for them, spinning them within 15 minutes and separating the plasma from the blood. Sometimes you need to freeze them, sometimes you need to split them because they go into different hospitals. And then we also have this section called special chemistry, where we have different analyzers that aren't on the track system that need special samples, or they need to be done in a certain time. The most enjoyable part of my role is definitely accomplishing all the work. I love to be caught up on everything because it means that we're not waiting on any results to go out. It means all the patients have got their results, they can be treated. It is hard sometimes to remember the patient at the end of it because we don't see them. But when I worked in quality, that helped me to picture the patient at the end of it, and obviously it does help them. It's quite satisfying to know that there are people that you're helping there and then on that day, which is nice. The most challenging part of my job is definitely the troubleshooting. Sometimes when we're doing our checks, they don't work as they should, and sometimes we need to change certain things. Sometimes there's something on the analyzer that needs to be freshened up. But it is a good puzzle to solve, which is why I like this type of work. In biochemistry, some of the skills I need are lab-based, practical skills. You have to be quite organised in the lab so that you know what you've done, what you're missing. So there's a lot of tick sheets, and I love paperwork. My advice to anyone younger, or even my younger self, would be to always understand you have the ability to change your mind. I did quite a few times. It was always very science-based, but it was always applicable because the skills that I had, I can now transfer into a lot of different parts of pathology. One of the other reasons I went away from research was because I could see the help that my work was doing in the lab. And it's satisfying to know that there are people that you're helping there and then on that day, which is nice.